There's new fallout this morning over the company that acquired a life-saving drug and gouged the price by 5% overnight. The outrage has now spread to the campaign trail and triggered instability on Wall Street. The CEO of Turing Pharmaceuticals is defending the decision to raise the price of the drug Daraprim from $13.50 a tablet to $750 for the same pill. Daraprim, which has been on the market for 62 years, is used to treat an infection that affects many AIDS and cancer patients, along with pregnant women. Now, for many of those patients, that raises their annual cost of treatment by hundreds of thousands of dollars. In an appearance on CNBC, 32-year-old CEO Martin Shkreli, a former hedge fund trader, vowed not to drop the price.
Did you not expect a 5,000% price increase would result in that kind of attention?
Maybe, maybe not. I mean, it really depends on how focused people want to be on the industry.
When you bought this company, did you buy it because you knew that you could raise the price?
We definitely planned on raising the price, that's for sure.
In response to all of this attention and doctors and patient groups saying they can't access this drug, are you going to change the price?
No.
Okay.
Well, Turing is the only, one of the only latest of a growing list of pharmaceutical companies that have dramatically raised prices recently. But with this story triggering a firestorm across social media, presidential candidates are now vowing they will push for action. Those promises have already sent some stock prices plunging. And joining me now, New York Times reporter Andrew Pollack, who covers biotechnology, along with Dr. Frank Esper, an infectious disease specialist at the University Hospital's Case Medical Center. Thank you both for joining us on this one. Andrew, let's start with just, I think, the basics here, because many people wonder, how is this even possible? And I think you see many people asking, how is this legal here?
Well, there are no controls on prices in the United States. Companies are free to set their own prices subject to market forces, which are often pretty weak. If there's, direct competition for a drug, that can limit the price. In this case, there really isn't much direct competition for that drug.
But you often hear, obviously, about the impact of a generic drug on the market, what that does, and people assume that there's a market established to eventually bring down the price of especially a drug that is older. This is the exact opposite of what's happening in this case. This is an older drug with now this extraordinary price.
Yes, well, this is a drug that had extremely small sales. I think the figures I had in my article were less than $10 million in 2014, and much, much less a few years earlier than that. That kind, the patents have expired. A generic company could produce this drug, but with that kind of a market, there's no incentive for a generic company to try to produce a generic. Now, if the price increase sticks and the sales of the drug grow to a couple $100 million, could there be would some generic company want to step in? We'll see.
Well, it's interesting. Obviously, people get caught up in personality, and a big rub for this, as you know, Andrew, has been the personality, this CEO, the way he's answered the questions. He sent out a tweet basically quoting an Eminem lyric that spells him giving the middle finger to his critics in his tweet here. But he's been accused of, at least according to the Associated Press, of trying to manipulate in the past with some drug prices.
Well, Martin Shkreli, he's as I said in my article, he's known for both his brilliance, or for brilliance and brashness. He had a previous company that had the same strategy of finding neglected drugs for rare diseases and raising their price to the level of sort of modern drugs for rare diseases. He ended up getting kicked out of that company, and he's in a dispute with them. He speaks his mind, and he has his strategy.
But Dr. Esper, let me bring you in, because obviously there's a larger conversation past this one drug and this one individual. The Chicago Tribune 2014 had the headline, "Generic drug prices skyrocket in the past year." I have in front of me a laundry list of other drugs used to treat a number of things, including heroin overdoses, another used to treat heart disease, and an antibiotic who all saw major increases. In some cases, one drug went up 212%.
Yeah, this is a big problem that we have here for medicine in general, is that there are certain drugs out there, if they're not one of the big money makers, they kind of get fallen off to the side, and they become almost like a little orphan drug just sitting out there. If they have low price, another company can come in, swoop them up, and start charging whatever they want because they don't have any competition. So you may have lost your patent, but if there's no other companies that are going to make a generic form, then there is absolutely no price pressure to bring the cost down low. And what that means from a physician standpoint is that our pharmacies may not stock these medicines in our pharmacies. They are not readily available, leading to delays in our treatment of patients. Or the force is that we have to use alternative therapies that are not as well tested or not as safe, filled with side effects.
I know that you've pointed out that, you know, obviously from your point of view, drug companies should obviously make a profit, particularly on antibiotics, but it surprised you, at least for a drug that to treat cancer patients. Is that the case?
Well, you know, you talk about some of the drugs, you know, where's most of the pharmacy making all their money from? A lot of that is through medications that don't necessarily cure disease, but basically work on protection or development of symptoms, and they're able to prolong life and thus continue the use of this drug. Whereas with antibiotics have been given up by big pharma. Almost all the development for new antibiotics are from very small companies. Why? Because antibiotics work and they actually eradicate the disease. And you eradicate the disease by successful cure, there's no need for further use of the antibiotics. That's a very small profit margin for companies, and so the big pharma has completely gotten out of the game. We do need these companies to make money. We need to entice them because we have run out of a lot of antibiotics. We're seeing an increasing amount of antibiotic-resistant germs that are leading to worsening death and mortality in the United States from diseases that we don't have any antibiotics for.
As I mentioned, Hillary Clinton will be addressing this a little bit later. Bernie Sanders and Congressman Elijah Cummings all have sent letters to this pharmaceutical company and are requesting investigation. So obviously this is not going away. Thank you, gentlemen, for your time. We greatly appreciate it. And coming up, from the front runner in Iowa to a flop.